Good morning, everyone. Thank you for joining us today. As you know, we've been holding these regular media briefings as part of Brown County Public Health's collaboration with our local healthcare system partners, Advocate Aurora and Aurora Bay Medical Center, Bellin Health Systems, Prevea Health, HSHS St. Vincent and St. Mary's Hospital. We're also working collaboratively with Oneida Nation Public Health and De Pere Public Health. I just want to let the media know that this is being recorded in speaker mode. So when you receive the recording later today, you should be able to use any snips for your story visuals. On behalf of our group, I also want to say thank you to the members of the media who have provided us with feedback in the past few weeks about what you'd like to see and hear on these briefings. We really appreciate the input, and we will be working to incorporate your ideas. Today's topic is actually one of those ideas. We're going to walk you through a day in the life of a COVID patient. You're going to hear from a patient who became very sick but was not hospitalized and what that was like. We'll hear from an emergency department physician about what goes on and what goes into the decision to hospitalize or not hospitalize someone. We'll talk with critical care physician about what the daily routine is like for someone who is hospitalized, as well as how treatments have evolved over the course of this pandemic. Lastly, we're going to wrap up with a physician who treats COVID-19 patients in the hospital, and we'll speak with them about what happens when people are able to go back home. Before we go to our speakers, I'd like to provide you with a brief overview of the current status of COVID-19 in Brown County. Today, we are looking at 23,110 individuals confirmed. That's an increase of 146 over yesterday. We're sitting at 125 deaths. That's an increase of 13 over yesterday. Out of isolation, we're looking at 20,109 individuals, which is an increase of 221 over yesterday. As always, you can see on your screen, you can find an updated dashboard daily online at www.stayhealthybc.com. You can also check the Wisconsin Department of Health Services or DHS website for current and up-to-date information. So chances are by now everyone on this call knows someone who has had COVID-19. I think it's safe to assume that everyone's experience with the virus is vastly different because COVID is unlike anything that we've seen in our lifetimes. That can make it difficult to talk about a typical case of COVID, but there are a few commonalities that we have learned during the course of the pandemic, and that's what we're going to share with you today. So I'm going to introduce Mayor Boyd. Mayor James Boyd is the De Pere mayor, and he developed COVID-19 and has since recuperated. So thank you for joining us today, Mayor.
Thank you.
Can you tell us a little bit about what it was like to have COVID and how your symptoms progressed?
Sure. Before you go, I'm getting feedback. There is feedback on your end. Can you hear me okay?
We are getting a lot of feedback.
Yeah. Still getting it. Do you want me to do something?
It looks like, Mayor Boyd, you're on twice on the WebEx.
Yeah, I somehow dropped out and then had to go back in. So should I get out of one of them? How do I drop out of one of them?
Do you see two screens or two different WebEx?
I do.
Okay, just hit the X out of one of them and we'll see what happens. If we lose you, we'll just have you log back in.
Well, all I can see to do is just chat. How do I click out of one of them?
Try hitting the escape button on your keyboard.
Okay, I tried that. I'm sorry, everybody.
That's okay. Do you see the X button now or not?
All I have is the three. Okay, there we go. Someone got me off. I'm off. Is that better?
Perfect. Much better.
Can you still hear me?
Yeah.
I'm sorry, Claire. What was the first question again?
That's okay. Just talk to us a little bit, Mayor Boyd, about your symptoms and how did they progress and what happened?
Sure. So I was diagnosed on September 24th, COVID positive. And I would say I had some symptoms maybe the day before. And the symptoms were runny nose, a little bit of cough, maybe some body aches and fatigue, but I'm not exactly, I can't really remember. It's a while ago. And then what happened was I was on a call with our health director, Debbie Burmeister. And then on the call, I coughed a little bit. And then she said, "Boy, what was that?" And I said, I don't know. It's just something that just kind of flared up. And she said, "You really should get tested." So I'll be honest with you, I wasn't really thinking of getting tested because it didn't seem really that severe. But clearly at that point, the instructions were, if you have any of the slightest symptoms, do it. I did. And then, the rest is history. So I had nothing more than just a little runny nose, a little bit of cough, and maybe a little fatigue, probably for about a day or so.
Many people, Mayor, aren't sure when they should seek medical help. Did you seek medical help, and at what point was that for you?
The only medical help I sought was obviously the test. But what happened was September 24th, I was diagnosed. So I probably had it for a couple of days. Anyone I was associated with did not get it. So there's no one in my circle. I masked everywhere. Still not sure how I got it. Obviously, it's very powerful and very contagious. I was really sick for about 12 or 13 days. And by about the 10th day, my wife was very concerned. I was very concerned. But I was to the point where I couldn't even get up. I did have some friends of mine that gave me a pulse oximeter. I think I'm saying that correct. And then I was able to check my temperature. But by about the 11th, 12th, 13th day, I could barely do that. So I never went in. I never was hospitalized. But I sure got to figure I was pretty close, because that's as sick as I've ever been, during 13 days.
So you weren't hospitalized, didn't seek medical care. What were your days like at home, Mayor?
The days were horrible. I think there's up to about 11 or 12 symptoms now, so I'm not sure exactly the symptoms I had. I was just very, very, very sick. So one of the symptoms I had was I was nauseous, and I couldn't eat. So I didn't eat or really drink much of anything for 13, 14, 15 days because it wouldn't let me. Everything was repulsive, and that didn't help because I know I needed to have something to eat and had to consume things, but I just couldn't do it. So the days were pretty much just be sick, sleep a lot, as much as you could because it wouldn't let you sleep. One of the symptoms I had was I had this really bad discomfort or pain in my leg, in my left leg, which only started when the whole thing started, so it wouldn't let me sleep. I lost taste and smell right away. Still have no smell. Taste is coming back a little bit, and I'm 2 months and 2 weeks in.
So I was just going to ask you that, Mayor. How are you doing now?
Yeah, I mean, 2 weeks and 2 months and 2 weeks in, I literally the past weekend was probably my worst weekend in a while. Still very fatigued. That's gotten a little bit better the last 2 days. Taste and smell still isn't there, as I just mentioned. Just not good. Pretty much run down, and to the point where I went to the doctor, I think it was 2 weeks ago. They did draw some blood and did a number of tests. So I had an echocardiogram yesterday and still waiting on those results. So hopefully that turns okay with my heart. But chest tightness is still something that really bothers me. And I'm not sure how long that goes or what anyone can do. They often reference us as COVID long haulers, which just isn't really a fair description. I think I saw the other day that the state stated that 83% of those that tested positive are recovered. I still don't consider myself recovered. I have not had a quality of life since it started, and hopefully that that turns around pretty soon. So I think people have to realize that there are a lot of people like me, and they're going to hear me say this, that we are not well, we are not recovered, and this still continues.
Any other thoughts or advice that you have for the public or that you would want someone to know?
Yeah, I mean, I'm sure we're probably well past halfway of this whole pandemic, and the vaccine's on the horizon, but we have a ways to go. So I think the residents have to realize, for us to get any kind of normalcy, and hopefully sooner than later, that they have to continue to mask, follow the mitigation efforts that the state, the county, and the city, and hopefully soon the federal government puts in play. So I just urge residents to continue to be, vigilant. Take this seriously. I know a lot of people out there, I shouldn't say a lot, but a number of people are doubters in this whole thing. And I'm sure whatever I say will not change their mind. But if they have any compassion or sympathy for those that they love, they have to take this seriously. And we have to take this to the finish line and and hopefully that's sooner than later. So the message I have is we're not done. We're not even close to being done. I think that together all of us can get us to the end, and that's my biggest message.
Love that. Thank you so much for joining us today, Mayor, and we appreciate you taking the time to share your story with us and share those thoughts. As you heard, Mayor Boyd didn't have to seek medical attention or be hospitalized when he developed COVID, thankfully. But for others, their symptoms or their underlying health conditions may make staying at home not an option or not possible. So joining us next is Dr. Brad Burmeister. He's an emergency department physician at Bellin Hospital, where he regularly assesses and treats COVID-19 patients who come in for emergency care. Dr. Burmeister is also the president-elect of the Wisconsin chapter of the American College of Emergency Physicians, and he serves on the Wisconsin Medical Society COVID Task Force. Dr. Burmeister is passionate about educating the community on matters of health and well-being. Thank you for joining us today, Dr. Burmeister.
Thank you for having me.
So you see COVID patients every day. How does someone know whether they need to go to the emergency department or to the hospital for their COVID symptoms?
I think that's one of the most challenging questions we have in emergency medicine and really in healthcare. Short of having a physician or a nurse at your house who can take your vitals and examine you and let you know if you need to come in or not, it's really hard to guess. With COVID, we have certain patients that we've been providing with a pulse oximeter, which it sounds like Mayor Boyd had, that can give you an objective number, can tell you what your pulse oxygen is and how well you're oxygenating, at any given time. So that's a really valuable tool that we have. But certainly in healthcare, we follow what's called the prudent layperson standard. So if someone feels like they're unwell, maybe they're weak. We see a lot of patients who are falling frequently, sort of like how Mayor Boyd was describing how weak he felt, or they feel really short of breath. And people who are having symptoms like that should be assessed by a healthcare provider, either in an urgent care respiratory clinic setting like we have at Bellin Health, or in the emergency department.
So you sort of answered my next question, Dr. Burmeister, but are there other factors that go into deciding whether an individual should be admitted to the hospital or not, or is there a certain tipping point that you would use to make that decision?
That's also a great question. COVID really seems to present a fairly wide spectrum and severity of illness, as we have all heard about. Certainly, it's mainly a respiratory virus, so it impacts your lower respiratory tract and can cause hypoxia or low oxygen reading, and that would make people feel really short of breath. And oftentimes, if you're hypoxic or your oxygen is too low and you're oxygen dependent, that would lead to hospitalization and further treatment in the inpatient setting. We have some patients, though, that we've seen who are not hypoxic, but they just have no appetite. They can't keep any fluids down because they just feel nauseous and have such a food and fluid aversion from that loss in taste and smell that they encounter. And we have seen some patients that can get fairly dehydrated, requiring either some gentle hydration and go home, or some people get so dehydrated that they're again leading to falls, could have traumatic injury from a fall, requiring hospitalization. So it's a bit of a spectrum, and I think that's part of it, which makes it a bit challenging with COVID.
We know that COVID elicits a lot of emotions for people. In addition to being very sick by the time they come to the emergency department, what are you seeing? Is it fear or worry, or anyone expressing regret for not being more careful?
Another great question. Again, we see a spectrum. I have some patients who just are devastated that they hear that they have COVID-19 infection and actually seem to be doing quite well. Whereas we have other people who completely decline having a test even done because they don't want to become a statistic or a number for the government, which is their perception of COVID-19. So it's a large spectrum. I think the most important group, though, is we have a large group of people who really are surprised when they get infected with COVID. And when you ask them a little bit more about have you been wearing a mask? Have you been trying to stay at home? And eventually the truth comes out that they probably were doing larger group settings, which they probably end up regretting and probably really shouldn't have been doing if they truly wanted to avoid the transmission cycle of COVID-19.
Given all of your firsthand experience, Doctor, with COVID, what's it like for you to see people in the community not following public health or medical recommendations?
I think that it's sort of interesting. You know, you see on social media a lot of people get really upset and emotional that there's, you know, a sector of our community and our country that doesn't mask or really follow the recommendations. I found that I'm not as in tune as other people seem to be. You know, just going to the grocery store when people aren't masking, I always feel like people wearing masks is relatively good out there, and some people think it's absolutely horrible. But I think the most challenging and perhaps upsetting part is like the social media myths that are pervaded quite aggressively that really challenge the years of experience and medical training that we have. And you read them and they're pretty obviously not true. Just getting the quick read of it and doing some further research quickly proves that. But there's a large portion of people that you can't convince that what they're sharing is not accurate. And I think that's been the most challenging part, is that people that you know relatively closely trust some person from some random state that they don't actually know, that they share their Facebook posts, but they don't trust you, who you've grown up with and have had medical training and dedicated your life really to studying disease and helping people be well.
Yeah, that's frustrating. Well, thank you, Dr. Burmeister. We really appreciate your time, and we appreciate you coming and speaking with us today. So Dr. Burmeister talked a little bit about the factors that go into the decision-making process when you need to hospitalize a COVID patient. But after that, we want to talk about what happens next. So what's a day generally like for COVID-19 patients? How have treatments evolved over the pandemic? And joining us now today to talk about that is Dr. Saeed Shah, a critical care physician with Aurora Baycare. Dr. Shah has been dedicating his time working in the ICU at Aurora Baycare Medical Center during this whole pandemic this year. So he's been able to see firsthand how COVID-19 has changed medicine, how hospitals are responding to patients, and the impact that it has on the community. Dr. Shah, as someone, welcome, first of all, as someone taking care of patients in the COVID-19 unit on a daily basis, what is the day like for them, and what is the day like for you?
Yeah, thank you for having me. It has been a challenge since the beginning of the year, once we started seeing the COVID-19 patients here. Meaning we see patients on a daily basis who usually the normal routine for a patient who gets admitted to the ICU is that they have family around, that the family support is there. And unfortunately, with these patients, majority of them don't have any family that can come in and see the patient and be there with them. That has been emotionally taxing on the nurses in the ICU, on the physicians as well. And unfortunately, I have also seen a lot of patients who die alone when, that is the time that the family should be there. So it has been, there is a lot of psychological distress on the part of the healthcare providers, as well as it is really distressing to see, yes, we are there for the patient, the nurses are there for the patient, other healthcare providers are there for the patient, but they really need their family around. And that is the hard part that we have to deal with them. We try our best, and meaning we do try to help out with regards to if we know that there is not a lot, unfortunately, that we can do for a terminal condition in a patient. We try to see if we can get the family to at least, be there, see them, to say their goodbyes. But it is still traumatic at the end. An example I will give you, by the end, I am done with, we usually do a week at a time in terms of the ICU. And by the time that I am done, my family, my wife especially, looks at me and says, I'm not the same on the day that I started, and then at the end of the week, I'm numb. And I see that with all my partners. that it's numbing because I think that's one of the ways that we try to cope up with it is to suppress your emotions.
Yeah, and that's heartbreaking to hear, Dr. Shah. What have you learned from speaking with patients and their family members about the virus and the pandemic during your time in the ICU?
There are patients who got the virus despite trying to do all the social distancing, face mask, trying to stay away from large crowds. And then there are ones who got it because they didn't do it. So but there's no point in blaming one person or the other. But on the other hand, it's always the question, why me? What is it, why is it happening to me? So that's a hard thing. We try our best to support them in terms of emotional support and give a lot of hope. And, over time, over the past few months, 6-7 months now, we have learned quite a bit in terms of what we should do, what we shouldn't do. Previously, if we look at in other states or other countries, we would jump on intubating these patients. We try to avoid it as much as we can because we know that it doesn't necessarily help. We are more tolerant in terms of letting the oxygenation be a little bit lower as long as the patient is doing okay, looking okay, not, too short of breath. And at the same time, we have, evolved in terms of what medications we can use and which medications work, which don't. Right now, the light at the end of the tunnel is, yes, the vaccine is coming. That's going to be a huge deal. But at the same time, the community in general needs to understand it will still take at least 3-4 months for that to make a difference. And until that time, we still need to keep the masks on, need to stay away from large crowds. As an example, I will give you, meaning I have 2 teenagers at home. It's hard for them. It's online school. This is the time that they want to be out. They want to be with their friends. Meaning I have to sit down with them, talk to them why it's important, why they should be wearing a mask, why they should, even if they have to meet somebody, at least keep a social distance. Because if they make me sick, I won't be able to do my job. Other people are going to get sick. And on the other hand, at the same time, we also know masks does not only help the other person, it makes it less likely that you're going to get the virus. So there is a lot of education and a lot of especially with the young people, trying to make it sure that we will get through this. Hopefully by this time around next year, we're going to look at this and say, hey, we did good. There's a lot of hope. I think we'll get through this. We're doing well. It's just that we just need to sustain this a little bit longer.
You sort of answered my next 2 questions all in one, Dr. Shah, but do you have anything else to add about the improvements that have been made while treating COVID-19 or the vaccine?
Meaning the vaccine is going to be here hopefully soon, within a week or 2 weeks, hopefully. There are people working on it. They're trying to decide, who are the people who are going to get it. This is in process. But again, same thing. The vaccine, it will take time. That's one. So for the next, I would say through the winter, we still need to have the face mask on, make sure that there is social distancing, avoid large gatherings. And the second part with regards to the medication, the question that you asked, yes, we used to use certain antibiotics. We know they don't work. We, pivot away from those medications. The thing that really works is right now steroids. They're helpful. Some of the other medications that are out there, for example, antibodies and the plasma that we use, if you get it early enough, yes. Late in the course of disease, it does not seem to be doing much, unfortunately. So the one thing that I would suggest people is if they suspect that they have gotten exposed, one, or they think they might have it, meaning different hospital systems have different sites where they can check. Meaning, for example, in our case, the simple thing is if you go to AAH.org, symptom check, you can look it up, and this will at least give you a reassurance that it's less likely, or maybe you should pick up a phone and call your primary physician and get tested.
Thank you so much, Dr. Shah, for joining us today and sharing these important perspectives and information.
All right.
When someone is hospitalized, no matter what the medical condition may be, everyone, I think, looks forward and hopes that they get better and go home. So just as these factors play into someone being admitted to the hospital and staying there, there are factors that go into deciding when someone goes home. So joining to talk with us today about what goes into the decision-making process when going home is Dr. David Polubiak. He is the Director of Hospital Medicine for Prevea Health and HSHS Hospitals in Eastern Wisconsin. And he's also a hospitalist and provides direct care to patients hospitalized for COVID-19 at HSHS St. Vincent and St. Mary's Hospital. Thank you for joining us today, Dr. Polubiak.
Sure, thanks for having me.
Yeah, the first question I just want to ask you is, what is the average length of stay for a patient that is hospitalized with COVID-19?
Well, it's hard to get the exact number, but because some of them might be admitted and they get better right away. But I would say we're talking about 5 to 14 days. You know, it's a big window, but the spectrum is so broad from a day or two to the patients who end up in the ICU sick for 2-3 weeks or sometimes longer.
And what goes into the decision-making process to decide when someone is well enough to go home with COVID-19?
So not a lot different from if someone was admitted with a heart attack or a stroke. They have to be getting better. They have to no longer require things that only a hospital can provide, such as IV fluids, IV medications, complicated nursing care. But what COVID brings is a little bit of uniqueness, because near the end of a hospital stay, a lot of times these patients are much better. They feel better. They're asking to go home, but they still require large amounts of oxygen, too much to send them home with. So some patients, the last week of their stay, we're just trying to get their oxygen needs down to a level that they can go home with. That's the one area that's rather unique in their discharge.
Do you give any sort of special instructions to a patient that's been hospitalized for COVID-19 when you discharge them from the hospital?
Yeah, there'll be quite a bit of instruction. First of all, you have whatever their underlying medical conditions are, because things like their diabetes, their heart disease, their lung disease will be worse during this stay. So a lot of times they have new problems with old illnesses. But we also have to deal with the things unique to COVID. There's a propensity to develop blood clots. Several of these patients will go home on blood thinners, which is a whole new world for them. There will be instructions for looking for them to look for worsening symptoms. They can still deteriorate even after they've been in the hospital. So we give them instructions on taking their vital signs, measuring their oxygen. A lot of them will be on oxygen and they'll have to deal with that. We also then have to educate them on where they are in their COVID isolation. Some will go home and still be considered in that window of being contagious. So we'll go over how many more days do they have to isolate. We have some instructions for them if their breathing should deteriorate. We have some ways that we like them to lay flat on their stomachs. The amount of discharge instruction is very intense when they're going home.
What long-term effects have you seen patients that were hospitalized with COVID-19 experience?
Boy, there's pretty much almost anything you can imagine. But what we see commonly, especially, as a hospitalist, we'll frequently see COVID patients readmitted a couple weeks or even a month or two later. It's not COVID anymore, but it's complications. It can cause heart problems. It can cause strokes. It can cause kidney problems. And a lot of those issues are due to the blood clots it can cause. But then people with severe lung infection from COVID, they can come back later now with scarring in their lungs, even as short as a few weeks. And so they can have ongoing breathing problems despite being supposedly, cured of COVID, similar to what Mayor Boyd mentioned. They're still not well. We've seen somebody who developed a unique problem or a rare problem where when they stand up, they become very dizzy, their blood pressure drops, and they pass out. And they had none of these symptoms prior to COVID. Some of the older folks can still have this, actually even some younger folks, this mental clouding. They're not back to themselves. They can be confused. They can say we're living in a fog. These are all real and they happen on a daily basis. We're seeing these patients.
So you touched on this a little bit, Dr. Polubiak, but when someone goes home, can you talk a little bit about if they need to quarantine or not, or just because they were in the hospital from COVID, does that mean they're immune from getting it again or spreading it?
So we go by CDC guidelines, and that means you're considered contagious up until a certain point after you've started having symptoms. So if you start having COVID symptoms, you're considered contagious till about day 10, provided you're getting better. So if you're still having fever, if your cough's worse, then you're considered contagious. But if you're feeling better, you're clearly better, and you are 10 days past your first symptom, you would then be no longer required or asked to isolate. And again, there's some caveats depending on if you were very, very sick in the ICU or you have underlying medical condition that still put you at risk of your immune system being weak. We might spread that out to 20, 21 days. But mostly it's 10 days from symptoms or from the day you had a test if you never had a symptom. I'm sorry, did you have a second part to that question?
Can you talk a little bit about, is someone immune from getting COVID again?
Oh, sure.
If they have
Well,
it?
this is going to be, we're going to hear a lot about this in the coming weeks and months with the vaccine. But generally, we do believe there's some immunity somewhere around 90 days after you've had a clear COVID infection. Now, some are going to be longer, some shorter. There has been some published reports of people getting documented second infection. So it's not impossible, but we believe there's going to be at least this around 90-day window. Now, what we don't know yet is, same thing with the vaccine. When you've been vaccinated or you've had COVID, could you still be shed virus and be contagious to others? These are questions that there's no answer yet. And because of that, we need to assume you could. And masks, if we have a healthcare worker who's had COVID and comes back to work, we don't let them run around without masks. They're going to continue to mask, follow all the guidelines because we just don't know.
Thank you so much, Dr. Polubiak. We really appreciate your time and your insights today. Before we wrap up and take your questions, just so everyone, the media knows, we're planning a media briefing for next week. That will be December 16th, I believe. Before then, we hope to have a better picture of what the Thanksgiving holiday has looked like in deer hunting, what those impacts have had on our COVID-19 numbers, and we'll take a look ahead with the other holidays that are fast approaching. So I will open it up for questions now. As always, if you could please state your name, the media outlet you are reporting from, and who your question is directed towards.
Rob Sussman, WTAQ. My question is for Claire. As I understand it, the vaccine could possibly be sent out to places in Wisconsin within the next week or two, depending on when the FDA approves it. I know that they're using this hub and spoke model for distribution of the Pfizer vaccine because it requires ultra-cold storage. My question is there a hub in Brown County, and how is the health department kind of working in terms of vaccine distribution?
Hi, Rob. So that's a good question. There's not a hub yet, but we are actively working with our healthcare partners and other community partners to make sure that we're ready for when the vaccine does come. At this point, we're still waiting for the vaccine to be approved by the FDA tomorrow. So there's a meeting tomorrow, and then I believe there's another meeting next week on the 18th. So we're just really taking it baby step by baby step. As each step is completed and approved, we'll make sure to provide more details and information then. Any other questions today for the mayor or the doctors or myself?
I actually do have another for the doctors, Claire. I know that Dr. Polubiak had mentioned the possibility of reinfection. To your knowledge, has that happened in Brown County? And if so, what would the prevalence of such a thing be?
Yeah, I don't know of any that occurred in Brown County. My only knowledge is from reading some literature and some reports. Again, they were validated, confirmed, but nothing I know of in Brown County.
Yeah, this is Shah. Meaning we have had patients who would come in, but as one of the physicians mentioned, not necessarily because we're suspecting it's a recurrent infection, but because there are other complications associated with the COVID-19. So I don't recall, or I am not aware of, patients coming in because they had a second infection.
And then these long haulers, as some people have spoken about. I mean, has there been any literature on how long this might last until their kind of secondary symptoms dissipate?
Not that I'm aware of, no.
I would say not that I'm aware of either, though. I'm an emergency physician, so usually I focus on the acute setting. I would say, though, that I have heard 2 local cases of patients who had reinfection of the coronavirus. The challenging part is to really have it something that's publishable. You want to have the virus preserved from their first swab and then their second swab, so that virus can be further evaluated to see, is it exactly the same COVID-19 virus, or are there any small changes to the sequence of the virus genome. We're swabbing thousands of people. We don't have the capacity to keep all the swabs to exactly identify if there's been any genetic change in the virus. And both the patients I have heard about had very minor symptoms both times.
Any other questions for us today? All right, well, thank you for joining, everyone, and we will see you next week.